Hello, my name is Lisa Feldstein. I'm a health and fertility lawyer in Ontario, Canada. And in this video, I want to talk about the impact of COVID-19 on surrogacy in Canada. So one of the most significant impacts that I've seen is that intended parents have not been able to be present at medical appointments. And this is true for pretty much anybody who's pregnant right now. There's been an impact on the ability of a partner to come with, whether that's to ultrasound or other medical appointments. Often it's restricted to just the pregnant person herself. And when there's intended parents in the mix, some of these appointments are really, really important, like seeing their baby on the ultrasound for the very first time. And unfortunately, because of the different kinds of restrictions in place, this is one place where intended parents have been really left out of some of these important milestones that really help them feel very connected to the pregnancy. Second area where I've seen a huge impact, particularly at the beginning of the pandemic, is with respect to being present for the birth. And in the beginning of the pandemic, this was particularly problematic for anybody flying into Canada to be present for the birth of their child because, as you may remember, flights were canceled. So there were people who couldn't make it into the country or just made it in the nick of time and then had a lot of difficulty getting out of the country, had to quarantine for 2 weeks when they came in and then therefore couldn't go into the hospital. It was a nightmare. And so that nightmare is more under control than it was at the beginning, but it's still very much in place. And at hospitals, if they are in an outbreak, the rules might change. So every hospital is different. They are coming up with their own policies about whether a person delivering can have anyone in the room at all, or if someone is in the room, are they allowed to come and go, or do they have to stay the whole time? How many people? So it's really been on a very hospital by hospital basis, but there have been people who have had to be outside the hospital while their child is being delivered and not be there, right, waiting to meet their child from the moment of birth. And the flip side of that is surrogates have been stuck with this baby that they were happy to carry, but weren't planning on being responsible for an infant immediately after delivering without any help or support, and just weren't planning on doing that because that's not normally part of surrogacy. And then the third major impact I'm seeing with COVID is the discussions around vaccination. This is a controversial topic. Not everyone wants to be the first to get the vaccine. Some people are unsure. And then there's an interplay here because surrogates have complete control over their own bodies, and yet they are carrying someone else's child. So how does this work? So it's something that we're discussing as part of surrogacy agreements now. Often intended parents, some really want surrogates to get the vaccine, some don't. And surrogates, of course, have their own perspectives on what they want to do with their body. So often we're putting language in about kind of agreeing to decide based on the most available evidence at the time, and they will speak with the doctor who's taking care of the surrogate to try and make sure that their decision is one that is evidence-based. And so far, I have not seen any conflicts arise out of this, but I could imagine in some cases where there is a dispute. I don't know if that would be enough for someone to decide not to pursue surrogacy with a surrogate or vice versa, for a surrogate not want to move ahead, but it's certainly something new that did not need to be contemplated in previous surrogacy agreements that now we do need to turn our mind to because we want to make sure that there are no conflicts during the pregnancy. And so that's sort of the main three things that I'm seeing. There are, of course, other minor things that are being drafted into agreements and into the protocols at fertility clinics and so forth, but those being present for appointments, labor and delivery, and the vaccination are the three big ones that I've been observing of how it's changing my surrogacy practice. So I hope that you learned something new, and I'll see you in the next video.